Hello everybody, welcome to this channel where medical topics are made easy. And today we're talking about women's health after menopause. Now if you are new here, please make sure to click that subscribe button so you can be notified every time we post new videos. And if you find this video useful, please give it a thumbs up. Alright, so let's jump right into it. What are the risks for women after menopause? Well, before we get into the list, it's important to know that menopause is a natural biological process that all women go through. It is a time of many changes in hormone levels, which then causes changes in the body. Menopause usually occurs between the ages of 45 and 55 years old, and it's considered to be final when a woman has gone 12 consecutive months without having a menstrual period. The average age for menopause is 51. Now, menopause can occur naturally when the ovaries stop producing hormones, such as estrogen and progesterone. But it can also occur earlier, due to certain medical conditions or treatments for those medical conditions. For example, certain surgeries like the removal of the ovaries, or chemotherapy and radiation. Therapy can all cause menopause to occur earlier than it would otherwise. Now, once a woman goes through menopause, there are several risks that she may now face that she did not face before. And we're going to discuss these risks, as well as some tips to help mitigate them. All right, so the first risk is osteoporosis. Now, osteoporosis is a condition that causes the bones to become weak and brittle, and it increases a person's risk of having a fracture. Now, this occurs due to a decrease in estrogen levels, which then leads to a decrease in bone density. Now, in women, the peak bone mass is reached in the late 20s and early 30s, and after that point, the rate of bone loss accelerates with age. However, this rate is increased further with a drop in estrogen levels, which occurs during menopause. The estrogen normally acts to preserve bone mass. So when these estrogen levels drop during menopause, it causes an imbalance in the process that leads to the breakdown and reabsorption of bone tissue, and this results in weaker bones. Now, it is estimated that approximately 1 in 3 women over the age of 50 will experience an osteoporosis-related fracture, and these fractures most commonly occur in the hip, spine, and wrist. Now, to help prevent osteoporosis, women should engage in regular weight-bearing exercise and also increase their intake of calcium and vitamin D. All right. The next risk we're going to talk about is heart disease. And before menopause, the risk for heart disease was thought to be similar in men and women, but after menopause, the risk increases significantly for women. This is due to a decrease in estrogen levels, which can lead to an increase in total cholesterol and low-density lipoprotein, or LDL cholesterol. These high levels of cholesterol then increase a woman's risk of developing heart disease. In addition to this, women also have an increased risk of heart disease due to the development of diabetes, which occurs more often after menopause. This is due to the change in body composition that occurs after menopause, which makes women more insulin resistant. Now, to help reduce the risk of heart disease after menopause, women should maintain a healthy diet, exercise regularly, and avoid smoking. All right, the third risk we're going to talk about is breast cancer. Now, it is estimated that 1 in 8 women will develop breast cancer in their lifetime. Now, although breast cancer can occur before menopause, the risk for breast cancer increases significantly after menopause. This is due to an increase in the size of the ductal system of the breast, and this then allows for easier access to spread of breast cancer cells. In addition to this, breast cancer cells require estrogen to grow, and after menopause, the level of estrogen in the blood drops. However, it has been found that women who have gone through menopause still have sufficient amounts of estrogen in the breast tissue itself to allow for the growth of breast cancer cells. Now, to help reduce your risk of breast cancer, you should maintain a healthy lifestyle. Avoid smoking, and also be aware of the signs and symptoms of breast cancer. These signs and symptoms include a lump in the breast, change in the size or shape of the breast, as well as any change in the skin of the breast, such as redness or scaling. All right, the fourth risk we're going to talk about is vaginal dryness and discomfort. Now, this occurs due to a decrease in estrogen levels, which then leads to less lubrication and less elasticity of the vaginal tissues. This can then cause dryness, irritation, and discomfort during sexual intercourse. In addition to this, it can also cause changes in the vaginal pH, which then puts a woman at higher risk of developing vaginal infections. Now, to help prevent vaginal dryness and discomfort, women can use lubricants during sexual intercourse, And also consider using vaginal moisturizers. Alright, the fifth risk we're going to talk about is urinary incontinence. Now, this is a condition in which a person has difficulty controlling their bladder function. This can lead to leakage of urine and can be very embarrassing for some women. Now, after menopause, women are at increased risk for developing this condition due to a weakening of the pelvic floor muscles. This occurs due to decreased estrogen levels, which then leads to less support for the pelvic organs, including the bladder. In addition to this, menopause can also cause an increase in the frequency of bladder infections, which can further irritate the bladder and contribute to urinary incontinence. Now, there are several things that women can do to help prevent and treat urinary incontinence. These include doing exercises to strengthen the pelvic floor muscles, avoiding caffeine and alcohol, and also maintaining a healthy weight. Alright, the sixth risk we're going to talk about is depression. Now, studies have shown that after menopause, women are at increased risk for developing mood disorders, including depression. This is likely due to a number of factors, including rapid and/or significant life changes, hormonal changes that occur during menopause, and also the realization that a woman's childbearing years are now behind her. If you are experiencing signs and symptoms of depression, it is important that you seek professional help. Depression is a serious condition, but it is also highly treatable. Alright, so the seventh risk we're going to talk about is a decrease in libido. Now, this is a term used to describe a reduced interest in sexual activity. After menopause, women are at increased risk for developing a decreased libido due to a number of factors. These include changes in hormone levels, changes in the body image, as well as a decrease in energy levels. Fortunately, there are a number of things that women can do to help improve their libido. These include engaging in regular physical activity, practicing good sleep hygiene, and also seeking professional help if needed. Alright, so these are just a few of the risks that women face after menopause. It is important for women to be aware of these risks, so they can take the necessary precautions to reduce their likelihood of developing these conditions. Fortunately, there are a number of things that women can do to reduce their risk for many of these conditions. These include maintaining a healthy lifestyle, being aware of the signs and symptoms of these conditions, as well as seeking professional help when necessary. Now, we would love to hear from you. What are some of the challenges that you faced after menopause? And what advice would you give to other women who are going through menopause? Please share your thoughts in the comments below. As always, stay happy and healthy. Hi there. If you're a fan of this channel, you'll love this playlist. It's got some of our most popular videos that will make you say, "Ah, I didn't know that. Check it out." I know you'll love it.